Up to 8 p.m. last night, we've had 12 new cases. Now, obviously, that's any cases are a concern, but 12 cases is positive, having in mind the tracing capacity that we have here in New South Wales, and also having in mind what is happening south of our border. 3 of those were household cases that were actually acquired in Victoria. 8 were locally acquired cases. 1 case was linked to the Tyre Rock at Wetherill Park. 2 cases attended the Apollo restaurant in Potts Point, and 2 cases attended the Mounties at Mount Pritchard. And 3 are linked to people who attended Mounties. So we've had obviously considerable numbers related to the cluster at the Crossroads Hotel, to the Our Lady of Lebanon Church, and also to Potts Point, Tyre Rock, as well as the Apollo restaurant. But you've also got to remember that a number of these cases now are not just primary cases, they're secondary, tertiary and quaternary cases. But our tracers continue to do an excellent job keeping those cases well and truly managed, in the sense that once we know who they are, who they've been in contact with, we can ask them to go into isolation, self-isolation, and they have our response from New South Wales residents to requests for self-isolation has been very, very good. So I want to thank them, thank the community for that. That takes us now, of course, to 103 cases associated with the Tyre Rock Wetherill cluster, but as I stressed, that's primary, secondary, tertiary and quaternary cases. So people who've family, friends of people who've been there or known people who've been there. 58 cases associated with the Crossroads Hotel cluster, and 40 associated with the funeral events in Bankstown, and 28 cases associated with the Potts Point cluster. I'm just going to emphasise this, that we really do rely on the community doing the best for the rest of the community and for themselves. The Premier's made the point that using masks in various situations is beneficial. I'm just going to ask Dr. Chant to make some comments generally about how we can continue to keep ourselves safe, having in mind those circumstances. When Dr. Chant's finished that, then what I'll do is I'll talk a little bit about the airport, and we'll have Therese Anderson discuss what they're doing, and I'll ask the nurse, Sarah Nilsson, to have some commentary about that. Then I'll ask Assistant Commissioner Scott White just to make some commentary from a police perspective, because it's all a team out at the airport. So much of what we're doing here in New South Wales has been a team effort, not just police, not just health, but the community. And our community is generally acting to keep us all safe, and I want to thank them for that. So I'll ask Dr. Chant now to say a few words about those issues to do with the numbers to date and any other issues arising with regard to masks and so on. Dr. Chant.
Thank you, Minister. So we are at a critical point in our response to COVID-19. The objectives currently are twofold. One is to bring an end to the current chains of transmission that our detectives are tracking down, and that is by making sure that we detect those cases early and make sure that the contacts are isolated, and that will allow us to break those chains of transmission. We're also aiming to make sure that we can recognise any cases in the community that are occurring. So as yet, unrecognised chains of transmission can be broken. And for that, I need the assistance of the community. I need you to come forward if you have any symptoms, however mild, that scratchy, itchy throat, that mild cough. Please stay home, get tested, and stay home until you've got those results. I would also like to urge the community to regularly look at our website, which has a list of the venues where infectious cases have been. There is specific advice for some venues where we're asking you to self-isolate for 14 days, get tested, and irrespective of your test, remain in isolation for 14 days. In others, we're just highlighting that an infectious case was there. In some settings, we think the risk was very low, but at the moment we're taking a very precautionary approach. We want to make that information available to the community, and in those circumstances we're asking you to monitor for symptoms and get tested should any symptoms occur. In general, everyone has a role to play in our response: business, government, and most importantly, members of the community. At this moment, it is critical that you maintain your social distancing, that 1.5 metres distance, and also that you wear a mask if you're going into situations where you're not going to be able to maintain that 1.5. And we're particularly focusing on the risks associated with indoor environments, enclosed environments. So if you know that your bus is going to be crowded, if you know you're going into a shopping site that is very crowded, we ask you to wear a mask in those settings. I should also like to say that business has a role to play as well, and we're pleased to see that business is really stepping up, ensuring those hand hygiene products are available at the entrance to stores, make sure that they display how many people can safely go into stores. This is all about preventing COVID transmission, and we all have a role to play. So thank you very much.
Thanks very much, Kate. We'll do questions at the end if that's all right. So I'll ask Therese Anderson, the Chief Executive of the Sydney Local Health District, just to give us a bit of background in a moment about the health hotels, the various structure or facilities that we have for people coming in from Victoria. Can I just say this though? The short message to Victorians is you shouldn't be coming to New South Wales unless you have a particular permit entitlement. So, and if you do come to New South Wales, you will be assessed by our health staff at the front line at the airport, and we have meeting each flight around about 9 to 12 health staff there, nurses, assistants in nursing, administrative staff working also with the police who are backing them in on this task. And some people will be able to enter, but it can be quite an onerous process because our health staff are doing a fantastic job. But I don't want to take Sarah's thunder on that, so Sarah can explain that to you, but quite amazing the level of examination that goes on in the process as a flight arrives and as people get off the plane. What I will ask the Chief Executive though is to tell us about what the Sydney Local Health District set up and the sort of circumstances in which people might go into those particular health facilities from Victoria. I know there's been some commentary today about why don't we have quarantine in the same way we have for international travellers. Obviously that was set up for a reason, and that is we need all international travellers to be able to be managed here, and we've done that very successfully now over some months. But what we are finding with most of our visitors into our state, if they're asked to, or returning travellers, if they're asked to self-isolate, they do.